This is one of my favorite exercises. It's the diaphragm release. How many times do we just have this chronic tension here? Whether it's stress and anxiety and kind of holding and sucking everything in, or we're just used to that like social norm where everybody has to be tight and skinny and as tight as possible in the abdomen. Well, we're going to release that. We're going to breathe as beautifully as we can. But sometimes we find tension along those ribs. So if you are palpating and you notice tension and you're just feeling like, oh, this area is tight, it's gross, it doesn't move as freely, I want to get that moving better. So this is easiest done laying on your back with your feet up, but I couldn't figure out how to do that for you. So instead, we're going to do it standing. So you're nice and relaxed. You're going to tilt your head to the side that you're working on. You're just going to breathe in and out. And as you exhale, you should be able to get your fingers a little bit underneath. You're not going to be digging in. Otherwise, you're going to be guarding, and it's just not going to feel good. So it's a gentle inhale, exhale, until you get just a little bit under those ribs. And then we're going to do an inhale, nice big as full as we can. And then exhale. And right at that end of the exhale, we're going to do what's called a cough and flick. So we're going to cough at the exact same time. Our fingers go up and out. So I'm going to show you. Inhale, exhale, nice and in there. Inhale again. Exhale. Gentle cough, flick at the same time. When you go back, you should notice that it's actually easier to get your fingers in there without grinding and pushing and making your abdomen actually more tense, because nobody wants to grind their little fingers in there. So it's a nice gentle release of the diaphragm so that you can get a fuller breath, so that you can inhale and exhale freely.